Hello, Dr. 2. I am starting my clinical skills assessment, and this is take 2 of it because I forgot something the first time. My girlfriend Abby is going to help me out with it, so I'm going to be using her for everything, and she'll be demonstrating some stuff. So the first thing we're doing is blood pressure. Oh, and my rubric is over here on my TV stand. It can't really fit into the picture, so I might just be glancing at it a few times like you said we could. But first thing we're doing is blood pressure. We're going to do it in sitting. I'm going to do it on Abby's right arm because we can't do it on her left. But the way it'll work is I will inflate the cuff 30 millimeters of mercury past when I stop feeling her radial pulse. And then I deflate 2 to 3 millimeters of mercury at a time. And what I'll hear during it is when I start to deflate, I'll start to hear a ticking noise at some point, which will indicate systole. And that noise will continue and continue. It'll eventually decrease and get harder to hear when I stop hearing a noise and I stop seeing ticking on the blood pressure dial. That'll indicate diastole. And so I can give a blood pressure report at that point. So what I'm going to have Abby do is sit just like so. She's going to put her right arm on my shoulder like so. I'm going to put the cuff on her over her brachial artery. Here, making sure I get the cuff tight enough. Okay. And so I'm going to put my stethoscope in. I'm going to use the bell end of my stethoscope, or the diaphragm end of my stethoscope, the diaphragm end to here into her cubital fossa. When I'm taking the blood pressure reading, I'm going to now inflate the cuff past the point of when I stop to feel the pulse of her right artery. Now keep your arm straight. Perfect. Okay. And I stop feeling it there. I'll put the stethoscope in here, and I'll start to deflate. All right, and so Abby was about 118 over 60 there, which is really good. She's got really good blood pressure, takes good care of herself. The next thing we will do is her heart rate. And so we'll do the radial artery of her right hand here, and I'll palpate it for 15 seconds, and I'll multiply that by 4. Typically, you could do this for a full minute if you wanted to. You could do it for 30 seconds and multiply by 2. If she had known arrhythmias, we would want to do it for a full minute. But we'll just do 15 seconds here, and then we'll multiply by 2. So I'm going to start here. Okay, and so that was 19 for her. So that would be about 56 when you multiply by 4. And again, if she had an arrhythmia, I could go all the way out to a minute. Next up on the rubric would be carotid palpation. And so to palpate her carotid, I'm going to do her left carotid. And so that would be under her left mandible, just in front of her left sternocleidomastoid. And I can find it right here. And I could palpate a pulse here too, but I need to be careful not to push too hard because I could distend her carotid body and sinus, and that could cause changes in blood pressure and heart rate, which could lead to bad things like she could pass out or something like that and fall. And so next up on is the ankle brachial index, the ABI index. So how that works is if we had Doppler equipment, we would take a systolic pulse in her brachial artery, systolic pulse in her dorsalis pedis artery of the same side, and then we would divide the lower extremity blood pressure by the upper extremity blood pressure, systolic pressures, and if that is 1 or a little above 1, that's good, we're normal. If it's below 1, it could indicate that she has peripheral artery disease or insufficiency. And then moving on to next is auscultation of heart sounds. And so we'll use the stethoscope for this. And describing it, we have our aortic site on the right at the second intercostal space, the pulmonic on the left at the second intercostal space, the tricuspid at the 4th intercostal space, and the mitral at the 5th intercostal space, and Erb's point is on the 3rd intercostal space on the left. Our S1 sounds are going to be loudest at mitral and tricuspid, and then the S2 sounds are going to be loudest at the aortic and pulmonic. S3 and S4 sounds or murmurs can be heard at the mitral and tricuspid, and we want to use the bell end of the stethoscope, whereas just to hear sounds we can use the diaphragm end if we want. And diaphragm end is going to be used for more of those higher pitch sounds using firm pressure, and the bell end for lower pitch sounds using lighter pressure. And murmurs are going to be whooshing or swishing sounds or any abnormal heart sounds that we hear, and they can be right before systole, right after diastole, and we would use the bell end to hear those frequencies. So I'm going to ask Abby, it's okay if we can put the stethoscope on her chest. Is that okay with you, Abby?
Yeah.
Okay. All right. And so I'm going to listen to the aortic first at the 2nd intercostal space, which sounds good. We'll move to the pulmonic. Good. We'll move to the tricuspid at the 4th intercostal space, which sounds good. And then the mitral, which also sounds good. I'll switch to the bell end now, and we'll try to listen to see if there's any murmurs that Abby could have. And I don't hear any, so it sounds like Abby's heart is doing good. Next on the rubric is the, so we've gone over where the heart sounds are, where we would hear them. Auscultation for bruits, carotid bruits. So I would use the diaphragm end here, and I would auscultate over the carotid body, or over the carotid artery. And what it would sound like would be turbulent blood flow, if there was something there. So we'll listen for that. And I do not hear any bruits on Abby, which is good. The next thing that we'll do is our pulmonary assessment. So we'll start with auscultation, and we'll start with the anterior view of Abby here since she's already here. What we'll listen to is the superior lobes on both lungs on the front. When we move down, we'll be able to hear the middle lobe on the right, but not on the left because it doesn't have one. And then when we move even lower, we can hear inferior lobes of both lungs on the front. On the back, we can hear the superior and inferior lobes of both lungs. So we'll start with the superior lungs on Abby, and we'll do it over her shirt. All right, Abby, go ahead and take deep breaths in for me. Good. 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 These are going to be superior lobes right here. Good. We'll move to Abby's middle lobe here. Good. Breathe again. Good. And then we'll move to the inferior lobes now. Good. Good. And now I'll have Abby flip to the other side so that I can hear the superior and inferior lung segments of both lungs here. So we'll start with the superior. Okay, Abby, take a deep breath in. Good. Again. Good. Again. Good. Again. Good. Again. Good. Good. Moving to the inferior segments now. Good. Good. And so all of her lung sounds sound good and normal. And speaking of normal lung sounds, which is next on the rubric, we have the tracheal bronchial sounds, which are going to be over the sternum, where the trachea and the main bronchi are. Next would be the bronchiofascicular, which would be between T3 and T6, or between the scapula. And these are going to be right on the outside of the sternum, and that's going to be more of like the tertiary bronchioles, the ending bronchioles. And then in the more of the periphery, we can hear vesicular sounds in the lungs, and those would be more of the alveoli. So next on the rubric, we're moving to airway clearance. And so we're going to drain Abby's posterior apical segments of the superior lobes of both lungs. So she's going to assume a long sitting position, lift her knees up for me. I'm going to put a pillow here. And then I'm going to have her slump forward and lean forward like so. Lean a little more forward. Perfect. And so that's going to drain those posterior apical segments of the superior lobes of both lungs. And we can do some percussion here too. And by that, I'm going to take my hands, cup them like so that we hear a cupping sound versus a slapping sound. Want to hear the cupping sound. So we're going to do that to Abby for about 15 seconds. Okay, Abby?
Okay.
All right. How does this feel, Abby?
Good.
Does it feel like I'm slapping you?
No.
Okay. Okay. And so that just helps to break up any secretions that can be in Abby's lungs if she had anything like that. Next, we'll do some breathing techniques. We're going to do the ACBT technique, which is going to include the huffing technique. So I'm going to have Abby sit at the edge of the bed. And so this is a technique to help break up secretions, improve breathing, help with anxiety and stress, and get rid of secretions as well. So we're going to start with diaphragmatic breathing, which is the first step to this technique. So she'll put one hand over her chest, one hand over her stomach, and she's going to want to breathe to where only her stomach hand moves in and out like so. We don't want the chest hand to move. So we'll breathe in, Abby. Moving only the stomach hand in and out. Good. And Abby's doing a really good job of that, moving only the stomach hand. And so we can do that for as long as we need to. And then we can move on next to chest expansion breathing. So Abby will place her hands on her rib cage, lower borders of her rib cage, and she'll breathe in a way that'll help to expand those rib cages. So go ahead and breathe to where your ribs are moving, Abby. Really think of expanding your chest. Good. Good. She's doing a good job of just moving those hands in and out like so. And we would do this breathing pattern for 3 to 5 times. And then we would end this technique with a huff cough. And so what that would be an inhalation followed by an exhalation and a kind of a huff or a cough noise. So like that. So you're going to do that, Abby. And if we did this, we would have something to help catch secretions if she had any, but I'm confident Abby does not have any. So we'll take that deep inhalation in. Now really force an exhalation with a cough at the end. Good. One more time. Good. And we could follow that up with more diaphragmatic breathing or more chest expansion breathing after we do that huff cough. And we can continue to do this cycle until we remove secretions, until the patient feels better, feels like they can breathe better. Next, we will move on to breathing exercises. So there's 3 that we'll do. The first one is going to be pursed lip breathing. And this is going to be good for anyone who has dyspnea at rest or shortness of breath at rest, tachypnea, things of that nature. So what we're gonna do is we'll take a deep breath in through the nose. And then when we breathe out, we're gonna purse our lips, making an O shape with them. And we can put our tongue at the roof of the mouth behind the teeth as well to help facilitate this. So we'll breathe in, make the O shape. Breathe out for 4 to 6 seconds. So let's do that again. One more time. Good. And again, that's good for dyspnea at rest, shortness of breath, things of that nature. And next, we'll move on to diaphragmatic breathing, which again is going to be good for tachypnea, dyspnea at rest, shortness of breath, anxiety. It helps to clear secretions and get things moving in the lungs. And we've practiced this before with the ACBT technique. It would be the same situation, hand over the chest, one over the tummy. You can start with this in supine if people are not so great at it, but Abby's pretty good at it, so we're doing it in sitting. So again, we'll breathe into where just the tummy hand moves. Good. She does a really good job of just moving her stomach hand. And again, this is a really good one for anxiety. It can be done for as long as needed until a person feels better, feels like their breathing is better, feel more relaxed, or feel like secretions are getting mobilized. And the last one we'll do is paced breathing. And this is done when endurance is low and when exercise tolerance is low. And it's performed during activities like stair climbing or lifting things. So I'm going to show Abby it first, and we're going to lift a backpack. When we lift our thing, so I'm going to have her scoot over. I'm going to sit here, and the way this is performed is we'll take a deep breath at rest, and then we'll exhale with pursed lips breathing, so making that O-shaped while we lift the object or perform the activity, so while we lift the backpack. So I'll take a deep breath in. Okay, so Abby will perform it next. Okay, Abby. So take a deep breath in. Now exhale through pursed lips, lifting your object. Good. Relax. Take a deep breath in. Good. Breathe out. Lift, lift. Good. One more time. Deep breath in. Let it out. Awesome. And so those are the 3 techniques. Those are everything for the rubric for the lab. Abby, thanks so much for your help. And yes, enjoy, Dr. Teal.